Well, let's take you to Ogun State, where the federal government has restated its commitment to revitalizing Nigeria's healthcare sector with a focus on improving the welfare of all health workers. Our correspondent Kazim Olowe reports.
The Minister of State for Environment, Isiaq Salako, has assured doctors of President Bola Tinubu's plan for improved healthcare system in the country. He made this known at the annual general meeting and the scientific conference of the National Association of Resident Doctors Health in Abeokuta. The conference, with a theme, Evolving Roles of Doctors in the Healthcare Management and Nation Building, provided a platform for discussions on the future of healthcare in Nigeria. The minister emphasized that President Bola Tinubu's administration is deeply committed to ensuring that the healthcare sector receives much-needed reforms, starting with the welfare of health workers.
What I can say is that government will continue to ensure that as much as possible we'll try our best to meet doctors, especially resident doctors, midway. They will give some concessions. Government too will definitely have to do something to ensure that we uplift their welfare. But like I also said, the commitment of Mr. President is to all Nigerians. And I could see that Mr. President wants to do all his best to turn around the fortunes of Nigeria so that all of us can start smiling again.
While speaking about the challenges confronting doctors working in Nigeria and their needs from the government, the newly elected executive of the National Association of Resident Doctors, led by Tokpe Oshundara, said the shortage of manpower and higher ratio of doctor to patients is contributing to brain drain in the country. They also want governors across the country to domesticate and start full implementation of the Medical Residency Training Act.
Some of them do not have that interest to fund medical residency, and you cannot expect a doctor to begin to fund out of his salary his own training, because for doctors we are not only doing service, we are also doing research, and in doing this research there should be some form of subvention for this very program. But the lack of political will to fund this residency is what has been stalling the residency training in some of our states.
They say with the support of the state and federal government and adequate welfare and equipment, Nigeria's health sector will take a new shape. Kazim Olowe, TVC News, Abeokuta.